Today on COVID-19 Local Impact, new scams for the new times.
And then all of a sudden, the fraudsters throw their stuff in and you're like, wow, is this believable? Is it not believable?
Sanctuary for frontline services.
Well, we're creating an environment that provides safety for their family. So at least they know that they don't risk exposing their family to the coronavirus.
And Premier Doug Ford details framework to get the province back to normal.
Let's just get it right the first time, and then we'll be able to have a better idea.
Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV Peterborough studios. After leveling out on the local curve last week, we've seen a spike in confirmed cases of COVID-19 in the area. In Peterborough City, County, and Hiawatha Curve Lake First Nations, 12 new cases alone. That brings the grand total for the area to 78, with 2,156 confirmed negative cases, 502 currently under investigation, 1 death, and 40 resolved cases. And I'll note once again that number 40 comes out of that number 78 at the top there. So right now there are 38 active cases in the region. In the city of Kawartha Lakes, 127 confirmed cases, 8 hospitalizations, 92 resolved cases, 32 confirmed deaths, 28 in long-term care homes as part of the 2 confirmed outbreaks. In Northumberland County, 13 confirmed cases, all 13 of them have been resolved. Premier Doug Ford to unveil reopening framework at Queen's Park. That was the headline on provincial media advisories this morning, perhaps raising the hopes and expectations of those who saw it. The Premier's announcement didn't offer any dates, but he does present a 3-point plan. Here's Doug Ford addressing the province earlier this afternoon.
Today, our experts are telling us that we're in the peak. How long this peak lasts remains to be seen. But now, thanks to all of you, thanks to the heroic efforts of our frontline workers, we're now in the position to start working towards reopening. We're in the position to set the conditions for reopening, and based on the best advice available to us, working closely with our health experts, our government has developed a framework for reopening Ontario's economy. This framework is a roadmap. It will guide our collective decision-making. It lays out the threshold we need to hit, the targets we need to work towards. Number 1, virus spread and containment. Number 2, health system capacity. Number 3, public health system capacity. And number 4, incident tracking capacity. The framework is about how we're reopening, not when we're reopening. And let me be crystal clear. As long as this virus remains a threat to Ontario, we will continue to take every precaution necessary. We will continue to act based on the best advice available to us. No one wants the economy to open up more than I do, but we can't take anything for granted. We can't take unnecessary risks, because we've seen around the world that all it takes is one person. If precautions are not taken, one person infected with this virus can spread it to hundreds of others. My friends, our future is in our hands. Because through our actions, by taking the advice seriously, by doing our part, we will determine when things open up again. The steps we are taking are working, but progress doesn't mean we can quit now. And that's why I won't set hard dates until we're ready, because the virus travels at its own speed. We must ensure our plans for reopening the economy reflect Ontario's unique situation. They must be responsible, they must be measured, and they must be guided by our Chief Medical Officer of Health, our command table, and our health experts. And I know how hard it has been for people. I hear and see the struggles every single day. Children walking by the playground, hoping they can play on the swings. Many sons and daughters seeing a loved one only through a window. Mothers and fathers dreaming of embracing their children for the first time in months. Grandparents aching to hold their first newborn grandchild. We're all missing birthdays, religious celebrations, and once-in-a-lifetime milestones. These are all too real. A painful loss of memories and moments taken away by this deadly virus. But that is why we must continue. It is why we're staying on the path of solidarity as a province, slowly, methodically, and gradually opening the economy. So this is the only time people will miss these moments. Together, we will create a lifetime of joy and special moments, time spent with family and loved ones, memories and moments that will never go away. Thank you, and God bless the people of Ontario.
Ford did field questions and was asked if the provincial government is feeling pressure to ease restrictions. In his response, Ford explains why the province isn't offering any hard dates at this point.
Oh, we aren't going to be rushed into anything. The health and well-being of the province is the number one priority, and making sure we follow the guidelines of the Chief Medical Officer and the health table. I know Minister Lecce announced that the schools will be closed by until May the 31st, and we'll be reviewing that as we get closer to that date. But again, I just don't want to go out there and start setting dates and we see a spike, and then all of a sudden we have to slow things down. Let's just get it right the first time, and then we'll be able to have a better idea. But hopefully, if we can see the numbers come down over the next couple of weeks, we'll be able to roll out or lighten up the measures from the Chief Medical Officer. But going back to the 4 guidelines I said earlier on.
We'll keep all the important updates from the Premier coming to you right here on COVID-19 Local Impact. Now, over the weekend, we touched on this off the top, but Peterborough saw 12 new cases of the coronavirus. Your TV's Mary Tendeshat speaks with Mayor Diane Therrien, who says the increase may be as a result of the warmer weather and the Easter long weekend.
I know that there was some discussion about, what if we were going to see an impact of, people visiting family and stuff over the Easter long weekends, which perhaps this might be attributed to because it's about that incubation time. So again, like the weather's getting nicer, people are, have been in this isolation mode for 6 weeks now. So I get that it's tough, but this is the problem, is that if people aren't abiding by this and the cases keep going up, then the longer we're going to have to stay in the isolation mode. So that's why we've really been trying to encourage people to, just as tough as it is, to stick with it, because the sooner we stick with it, the sooner we can come out of it.
And though the city is developing their economic recovery plan for when we come out of this, obviously at this point in time, there is no indication of any services opening up in the very near future.
No, I mean, municipally, we know our facilities are closed until the end of May. And, provincially, federally, the reps that I've talked to, this is one of the challenges about this pandemic, is that it's impossible to predict next week, never mind, a month or 2 out. So, this time last week, we thought the numbers were steadying off. We saw an increase happen over the weekend. So things are fairly unpredictable. I mean, what we do know is that things are tough and things are going to be even tougher. There's a lot of businesses that are really struggling. There's some that are doing okay. There's some that have been able to either retool or adapt to this, new scenario. But I think, we're just trying to figure out how to chart a path forward, so that when we do come out of it, we're able to be prepared for a similar occurrence should one happen in the future, but also making sure that we're building a strong, resilient economy that is more, equitable and sustainable than we've seen previously. So I think that there are going to be a lot of changes in the way that people work and that businesses work and that people interact with each other. So it's certainly an interesting time to be in this position and just to be, in this community, in this society right now.
Fraudsters and scam artists aren't taking a break during the COVID-19 crisis. Again, your TV's Mary Tendashat speaking with Detective Constable Keith Calderwood of the Peterborough Police Service, who says the fraudsters are taking advantage of people sitting at home as well as businesses who have established curbside pickup during the pandemic.
The reason why they're preying on people right now is because everybody's supposed to be locked inside. Well, when you're locked inside, you're near your phone and you're near your computer, the two easiest ways to be scammed. So you're on your computer a lot, pop-ups are popping up, stuff like that. You're answering emails, you're on social media, you're trying to educate yourself because there's so much information being thrown at you from all different angles. And then all of a sudden the fraudsters throw their stuff in and you're like, wow, is this believable? Is it not believable? That's what we have to come up with, right? But because of the COVID-19, the fraudsters are starting to take advantage of businesses because a lot of businesses now are not having their doors open, but they're allowing people to phone and make purchases over the phone and maybe do a curbside pickup. So when they're doing these purchases over the phone, then someone's giving a credit card number. Where the card not present fraud comes into is credit card numbers that have been stolen, not physically stolen, but just the number has been stolen. So you'll have people call in a big purchase, maybe a $4,000 TV, and they'll put it on a credit card number. Because that credit card has not been reported as stolen by the person who owns the credit card, because they physically have it, when they type that through in their card reader, then it is actually, it comes across as it's fine, that it's a good card because it is a good card. It's just that the number's been stolen. And then they have someone come to the curbside and pick up. So what has to happen in this situation is we have to be very vigilant about big purchases. Anything that's in the thousands of dollars, we have to be very careful of, okay? And then when they come to the curbside, we need to request to see that card and maybe take the payment at that time.
How many times has this happened in Peterborough that you've been aware of?
During the pandemic, I believe there's only been a couple. But still, a couple's too many. So we need the businesses to be vigilant and be aware that this is happening. And it's a very easy fraud for people to do. So we need to make sure we're on top of it.
So with those couple of cases, has the police had any further investigation as a result of that?
It is very difficult for the leads because, like I said, the physical card has not been stolen. So the people who have these cards in their wallets, until they get notified that they just purchased something in Peterborough for this amount of money, that could take weeks or even months before that even gets back to the actual person who owns the card. So by that time, there's not a whole lot going on. And for curbside pickups, not too many people have video and stuff like that. So it's very difficult for the police to investigate. And the fraudsters know this, and that's why they do these scams.
On Saturday, May 16th from 7 to 10 p.m., PTBO Strong is inviting you to tune in for Cove Aid, an entertainment-filled evening to enjoy with family at home. The show will be available right here on your TV and on the PTBO Strong Facebook page. PTBO Strong encourages you to share this on your personal social media feeds and to donate through the Canada Helps link on the PTBO Strong Facebook page. As COVID-19 local impact continues on your TV, updates from Northumberland and Otonabee Conservation's Dan Marinick updates us on program postponements. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. Otonabee Conservation's CAO Dan Marinick takes time to explain what programs, services, and facilities are still available and lists some of the annual community projects that have been postponed.
We're all subject to various emergency orders, essential services, orders around social distancing. And when you take a look at all that direction, we took a look at all the programs and services we deliver, and we applied that direction to those. What has become obvious to us is that we're not able to deliver education programs or some field stewardship activities or even some monitoring work. So we're suspending those programs for the months of April, May, and June. We operate two campgrounds. One is at Beavermead on behalf of the city, and the other one is Warsaw Caves and the property that we own. And we don't anticipate that we're going to be opening the campgrounds for campers until the latter part of June. But there are things that we do and we're still able to do. We're just doing them through electronic means. So receiving an application for a permit, we can do that. We do provide comments and reviews of municipal planning documents, and we'll continue to do that. We continue to monitor weather and water levels and issue flood warning reports and flood warnings. We're allowing people to use our conservation areas. We're asking them obviously to respect the social distancing rules and visit in small groups. And if the parking lot's full, to kind of move on, come back another time. But all of the facilities on our properties, like picnic shelters and privies and buildings, will all be closed. So we're encouraging people to use them for passive use, hiking, walking, biking, but do so in a way that respects the rules around social distancing. Those messages have generally been provided on our social media platforms, but we're taking the time now to pause and just restate them in a little more comprehensive way. So we do host a couple of spring cleanup events, which we're not doing obviously this year. And I know the Rotary Club, I think today put out something saying we encourage you to clean up around your own property and where you can. So if you happen to be out on our property and you see a piece of garbage and you think it's safe to pick it up, please pick it up. But we hope to later in the summer kind of host a couple of events that get back to doing the cleanup things that we would typically do this time of the year and as we celebrate Earth Week and Earth Day. One of the other things we often do and that we do every spring is a bunch of tree planting programs with Boy Scouts and school groups and stuff like that. So all of that is postponed. We're going to do fall tree plantings this year. Where it's not possible, it's just canceled for the spring. And we'll hope to kind of ramp up and get back to kind of a normal year through the summer months and into the fall.
A couple of weeks ago, we brought you the story Northumberland Hills Hospital was treating their first COVID-19 patient. Today, we catch up with hospital CEO Linda Davis for an update.
We did have an individual who was positive, was being treated at the hospital, was actually well enough to go home and continue on their recovery at home. At the moment, we have 6 individuals in hospital who are probable, so yet to be confirmed, and they're being cared for in our hospital.
Meaning probable as in you're waiting results of tests of COVID-19?
That's correct. They were screened for the various symptoms that have been listed and felt to be appropriate to test and have been tested, and were ill enough to need to remain in hospital versus going home for the rest of their recovery period. So these individuals have been admitted to our respiratory unit.
If they come back negative, do they get moved out of that area that you're currently treating those patients, or do they stay in there until they are able to be dismissed from the hospital?
That's a good question. What we have attempted to do is to create what we call a hot zone and a cold zone. A hot zone is where we would have individuals who are awaiting their swabs or are positive, waiting their tests or are positive from those tests. If they are not positive, then they would be moved depending on whether or not their needs can be met in that area. And again, if there's a need for that area for other patients who may be also positive or waiting results. So it really depends on the needs in the organization. We have the capacity to go within one unit quite expanded in the number of patients we can support there. So it really depends on the need, but we would probably move them out of that area into another area of the hospital for the remainder of their hospitalization stay, especially if it was a long stay.
Do you have a set number of beds that you are able to specifically say for COVID-19 patients?
Yes, I mean, we have the capacity and within our medical and surgical unit to go up to 37 beds dedicated to that, but we can also go beyond that. Right now, we have opened potential capacity to 134 beds. The hospital was built for 137, so we have a couple that aren't available, but otherwise we could open, and I think the estimate would be we could get as far as 80 different areas for patients who may be COVID positive.
Could you give us an update on how the hospital staff is faring as we continue on, and as we know we're into another 28 days of the emergency being in place by the province?
Certainly, I am so impressed with the planning that has gone on with the staff and physicians in the organization. I think I shared with you even last time we spoke about the preparation that's been going on. Things like planning for our first, second, third, fourth, 10th potential positive patient, as well as putting in place different policies, different medical directives that we need to use. So a lot of planning. We are prepared. Prepared for, as some would say, the worst, but hoping for the very best. I think the morale is still fairly good. We have sufficient supplies of personal protective equipment. So staff, in fact, we've gone to a universal masking policy. I don't have to wear my mask right now because I'm in the office alone, but otherwise we would be masked anytime that we're outside or interfacing with others. We've limited the activity in any of the clinical areas, and as well as tried to limit the number of management that are on site at any given day. We're all working, but we have a core team here, and the rest are supporting at home, and then the core team switches over.
The town of Coburg's emergency management team has set up an isolation facility for first responders and frontline medical staff. Coburg Police Chief Paul Vandegraff tells Mark Rockburn from Your TV Northumberland the isolation facility will provide a safe place for first responders to isolate and avoid putting their families at risk.
This is where the emergency control group really shows its mettle, and that emergency control group comes together. They speak about all sorts of things, and we quickly realized that there was going to be a need potentially for a relief base camp. So we were able to access some trailers from Owasco, which we were able to set up. And it was great ideas or great minds aligned. So the hospital was also looking for places for their doctors to park RVs. So as they ramped up and maybe had to work longer shifts, there was somewhere close where they could go and rest in between shifts. So as the great ideas came together, so was born the idea of the relief camp. We're ready to go. And as Graham Murchison always says, we are ready for whomever needs us. And I hope nobody needs us. So we're ready and prepared. Breakers has been absolutely phenomenal. Like I can't say enough about how great John and Andrea are down at the Breakers. They've been just tremendous, but we're just trying to alleviate the burden that they're bearing on our behalf. One is not in place of the other. They're going to run in parallel, but we're ready right now should we have to isolate one of our members.
With the base camp, Paul, I know there's been some talk of people in the community that should maybe funds be going towards that, because I know that there was a fence that was put up around it as well. But I think what people should know is that this was an effort that was made where everything has been donated to this base camp, as I understand it.
Yeah, again, it's a great effort of the town. Again, when you have an emergency control group that comes together, it really works. The Police Services Board had great connections with Owasco, so we were able to get those trailers. The town had great connections with some of their vendors from other products, so they were able to get some of the fencing. The town came together, Lucy came together to get that camp open up over Easter weekend, get the water running, get the hydro going, get the sewage open. So the goal is we're there, we're ready, and it was a community effort. And right now, we've had other small community donations from Pruitt, and I know I'm a Canadian Tire, Walmart. A few others have thrown in odds and sods, and that's awesome. But we're ready, and I don't think there's a call for money, but if there were ever a call for support, that would come from the emergency control group.
As of 3/28 on April 20th, Paul, has anybody had to use that facility yet?
As of today, no, we have not had to use the facility. Again, we are ready. You plan for emergencies in advance of what may or may not happen, so we are ready in case we should require it. The previous isolation is just about wrapped up for that particular person, and we'll see what the future holds.
And one final question, Chief Vandegraff. What's it mean to the frontline officers and medical personnel, fire, emergency services, to know that they have somewhere to go, that it's not going to affect, that they cannot put their family in harm's way?
Like I've said many, many times, it's protecting our families, the members' families. So if a member is exposed, we have a decontamination center here at the station where their clothes can be washed here. They don't have to bring them home to the same washing dryer that their family uses. If a member has to isolate pending tests or for those 2 weeks, we're creating an environment, well, where maybe not ideal, but still we're creating an environment that provides safety for their family. So at least they know that they don't risk exposing their family to the coronavirus.
And that's certainly an important resource for frontline workers in Northumberland. Applications open today for a $73 billion wage subsidy program to help businesses that have seen a drop in revenue because of COVID-19. First payments should begin to arrive on May the 7th. The support program covers up to 75% of wages for businesses affected by COVID-19. All sized businesses, charities, and nonprofits are eligible if they have had a drop in revenue of at least 30%. The subsidy is available for 3 months, retroactive to March 15th, and provides up to $847 a week per employee. Businesses are encouraged to set up direct deposit so they get the money as quickly as possible. That's our show for today. Thanks for tuning in. For Your TV, I'm Dan Malta.